Fifth disease, or otherwise known as erythema infectiosum, is caused by the B19 strain of virus. It is commonly spread amongst children through infected respiratory secretions, such as coughing, or can be transmitted from mother to fetus. It is most common in children and young adults and can be spread from animal to human. Fifth disease is most common from midwinter to early summer when children's immune systems are at their lowest. Around 50% of the adult population has been infected by the virus during childhood, making the person immune later in their lifetime. There are two stages of fifth disease. First stage symptoms will include a low-grade fever, malaise, a sore throat, headaches in the very early stages of the disease, and nausea. In the second stages of the disease, first stage symptoms disappear and are followed by a slapped cheek facial rash appearance. After 2 to 4 days, the facial rash fades. In the second stage of the disease process, pink patches and macule may develop in a lacy reticular pattern, most often on extremities such as arms and legs. After 1 to 6 weeks, the rash will eventually resolve itself, but is likely to reappear with sun exposure, heat, or stress. In most cases of fifth disease, there are no treatments as such, however pain can be managed with the use of paracetamol. Fifth disease can severely affect people living with conditions such as pregnancy, weakened immunity, as well as hemolytic blood disorders. Pregnant women who have fifth disease are at risk of experiencing a miscarriage or having a stillbirth. Although there is no treatment for the disease, close monitoring of the baby while in the womb is necessary to watch the development of the baby. In cases of people with weakened immunity, such as cancer patients, severe asthma patients, or HIV/AIDS patients, they may require blood transfusions as treatment to maintain their normal level of hemoglobin in the blood. Diseases such as sickle cell anemia, thalassemia, and hereditary spherocytosis can also experience a sudden drop in hemoglobin, which is responsible for transporting oxygen around the blood and can lead to sudden heart failure. However, this is the worst possible outcome and is very rare. Fifth disease usually poses no long-term health risks and is usually self-controlled. But in order to look after someone with fifth disease, it is very important to go and see your general practitioner or GP so that they can do a physical examination. The doctor can observe the symptoms of fifth disease, such as rashes, headache, sore throat, and slapped cheeks, and can recommend blood tests for detecting antibodies. As well as going to see a GP, it is important for the patient to get plenty of bed rest and increase their intake of fluid to stay hydrated. Unfortunately, there is no vaccine for fifth disease. However, there are many other preventative measures that one can take to avoid catching or spreading the disease. These measures include regular sterilization of hands via alcohol rubs or soap and water, cleaning surfaces that are contaminated with discharge from the mouth and nose, not touching these areas, avoidance of interpersonal contact, and staying home when you are sick.